Well, good afternoon. Thank you for being here today. We are going to begin today's remarks by recapping our new Safer at Home order, which began at 8 a.m. this morning. As a reminder to those of you in the more vulnerable categories, those over the age of 65, those who have pre-existing conditions that would make yourself more at risk of this particular virus, we are encouraging you to continue to stay at home unless it is absolutely necessary that you move around. For those of you that need help, we encourage our churches, our voluntary organizations, and quite frankly, just our neighbors and friends. Please go out and help your neighbors get groceries and other things, so if they are older or in a more vulnerable population, that they do not have to get out and about and subject themselves to this very, very dangerous virus. As we have said with respect to reopening our economy, I listened to other governors around the country talking about maybe opening up some outdoor construction and maybe opening up some manufacturing in 2 or 3 or 4 weeks. Well, as I hear other governors say that, I'm reminded that those industries in our state were deemed open from the beginning, and so when we are talking about reopening our economy, we want to recognize that we had a large portion of it open this entire time, but also recognize that there are many, many Mississippians that are hurting. There are many Mississippians who have lost their jobs over the last 3 to 4 weeks, and we know that we've got to do everything we can to get them back to work as soon as humanly possible and as soon as it is safe. With respect to that, we are not going to flip a light switch as if it were on and off. We're going to use it as if it were a dimmer, and we're going to continue to, in a responsible way, make it better and better for all Mississippians. I know that Dr. Burks was on some of the national shows over the weekend and used that, and I appreciated that. We had just got off the call with the White House, in which Dr. Burks acknowledged that. We do appreciate having the opportunity to work with her over the last several weeks in our plan to reopen our economy. We had a very good conversation with President Trump, with Vice President Pence. I assured the President that while some in the national media may not appreciate or respect the incredible job that he has done with respect to this virus, the people of Mississippi certainly recognize his work on it, and we thank him. We know that there's more work to be done, but we are headed in the right direction. We are going to continue to keep public health as our primary objective, keep it at the front of our minds, and we know that the threat is not over. It is real, it is deadly, and we must take it very, very seriously. So even as we phase into more and more reopenings across the state of Mississippi, we want the people to continue to be vigilant. Our movement is from government shelter in place mandated for a few weeks to individuals taking responsibility for themselves and their neighbors and making sure that you are doing the right things. I trust the people of Mississippi to be vigilant, to do the right thing in the coming days and weeks, to continue to see the slow of the spread of the virus so that we protect as many Mississippians as is possible. Over the weekend, and I'm going to let Dr. Dobbs give you the specifics, over the weekend we did have a couple of days of numbers well below 200 new cases. That is very positive, but again, a couple of days does not a trend make, and we're going to continue to monitor that just as we did on a couple of days when they spiked up just a bit, at least relative to our numbers. Again, I want to tell you how grateful I am to the people of Mississippi. You have done great things over the last several months. You have stepped up, you have helped yourselves, you have helped your neighbors, you have helped us slow the spread of the virus, and because of that, we are able to move towards more and more reopening and at least a life that is more and more normal for more and more Mississippians. Though we also know that we will not be able to move back to completely normal for some time now, and we're going to be responsible about the way in which we get there. So with that, I'm going to turn it over to Dr. Dobbs and let him give us a specific recap on where we find ourselves on this Monday, April the 27th.
Thank you very much, Governor. As a quick update, we're reporting today 183 new cases and unfortunately 2 additional deaths. Again, this is a considerable drop from the days previous, but then again, we have to be conscientious that there's a lot of variability day to day, so we'll continue to watch that closely. Still, we do have a significant disproportionality in deaths and cases among African Americans. Over half of the cases are African Americans, and over 60% of the deaths are in African Americans. If we look at our public health lab and then our private labs, we are reporting out 63,462 individuals tested for COVID-19. Want to continue to get testing performed. Very proud of the work of everyone involved. If we talk about our hospital capacity, we're continuing to see some stability and some modest decreases over the last several days. Total number of COVID patients on ventilators is 71. ICU beds occupied by COVID patients, 142. We've seen some short-term trends in COVID suspects and in COVID patients in regular hospital beds. That's not surprising. You know, they'll leave quicker out of a hospital bed, so that would be a leading indicator from that perspective. A couple other things I do want to mention just really quickly. As far as testing, we know that testing is a critical component of our strategy for getting back to some degree of normal life. Today we are doing testing in Tylertown and Tupelo. Tomorrow, West Point and Madison. On Wednesday, Macomb and Carthage. And on Thursday, Bolton and Greenwood will be drive-through clinics. Go to the UMC website and look at COVID, and you can register to be seen. One thing with testing, because our testing capacity is strong right now, and because we're having fewer people who are having to come in with symptoms, we are going to lower the criteria for people to get tested through these criteria. So if you have any symptoms of COVID, don't have to have necessarily a documented fever, or if you think you might have been exposed, please register for the drive-through clinics if in fact you're in those areas and want to get tested. But you do have to do it ahead of time so that they can create a record and have you get an appointment so you can get tested. So please get tested. The other thing I do want to mention real quickly is the mask situation. I know we're all trying to get back to some semblance of normalcy. I'm tired of it too, but as I go around and see people out in the community, I'm not seeing a whole lot of masks. So you people who do wear masks, I applaud you. You're protecting yourselves, you're protecting your family. COVID is still out there, and it could rebound. What we do now while we're trying to ease back into normal operations is so very important. Those small, simple, easy things you can do as an individual are going to make all the difference. So strongly encourage people to take that personal initiative. Don't go to the store if you don't need to. Don't take the whole family to the store. Please just send one person, get what you need, get in, get out, wear a mask, stay away from folks, and use hand hygiene. The other thing you'll note, as we're going back into clinical practice, people need to get checked on for medical problems, maybe some surgical procedure they've been waiting on, or some dental work that maybe is a little bit more urgent. The expectation is going to be for every patient to wear a mask in the waiting room. So this is something that it's going to be hopefully a universal thing. So when you go to the waiting room, plan on bringing a mask with you if you have it, but if not, it's our expectation that the clinic will provide it for you. And that's all I have for today. Thank you, Governor.
Thank you, Dr. Dobbs, for your excellent work during this time. I want to just reiterate for the people of Mississippi something that Dr. Dobbs said. Every single day, we are enhancing our capacity to do tests. We are working to expand it. We are doing drive-through testing sites and have been for nearly a month. But one of the things that we are seeing now is that while supply of testing capability continues to increase, the demand for tests seems to be declining. Now, I actually heard Governor DeSantis in Florida say the same thing earlier. I think we're seeing that in some other states as well. And so that is an issue that I just want to bring forward, that if you believe that you have been exposed, if you know someone that you've been in contact with that has been diagnosed with COVID, regardless of whether or not you have symptoms, we really need to think about getting tested. I don't think it's realistic, and I've said it before and I'll say it again, we're never going to get in a situation in which we're going to try to test every single Mississippian every single day for COVID-19. That's not realistic, and quite frankly, I don't think it makes much sense from a public health standpoint. But in these days, as we are trying to ease back into a more normal economic climate, it is helpful to us and ultimately helpful to you, and particularly helpful to our identify and isolate strategy, that if you believe that you have been in contact with someone and that you believe that you may have it, that we can test you, because if you test positive, we can then isolate you for 14 days so that you don't asymptomatically actually put more and more people at risk. That's very important and something that we're going to continue to work towards. With that, I'm going to turn it over to Director of MEMA, Greg Michelle, for updates from MEMA's perspective.
Thank you, Governor. Just to give a quick update on where we are with the storms, to go back to the Easter tornado, we will be adding, with joint damage assessments being completed for 7 more counties, we will be requesting that those counties be added to both PA and IA assistance. Those counties are Carroll, Clark, Grenada, Jasper, Lawrence, Panola, and Walthall County. And I want to reiterate that does not necessarily mean that other counties will not be added, but those are the counties that we have completed joint damage assessments as of today. Disaster assistance centers in support of the Easter tornado. I briefed that this past Friday, just to announce those again. There's a disaster assistance center that's located in Covington County, the Seminary United Methodist Church, in Jefferson Davis County at the L.L. Roberts United Methodist Church, and then one in Jones County at the Antioch United Methodist Church. We will be adding a 4th one in Jones County at the basically Jones and Jasper County line later this week, and I'll make an announcement on that location tomorrow. Damage assessments for the storms on 19 April as well as 22, 23 April are still ongoing. We're working through that as quickly as I can. I want to remind everyone that you do not have to wait for a damage assessment to be made or for someone to come to your house. You can go to Crisis Track and use the damage assessment tool and upload your information as well as any photographs that you have. You can find the link to that based on your county if you go to my website at www.msema.org. Pull up contact and go to the self-assessment tool and upload your information right there. As a reminder, just to let everybody know, your damages are going to start with your county emergency manager in your county, and then that information will be provided to me, and I will make the request for declaration on the county's behalf to FEMA, but that's the process there. And then finally, I just want to remind everyone, we do have another round of severe weather that's projected to come through tomorrow night, early Wednesday morning. It currently is considered a low-threat weather system, but as everyone knows, this is the month of April. It could change very quickly, so just please pay attention to the weather. It could change as we move towards Tuesday. Governor, subject to your questions, that's all I have, sir.
Thank you, Director Michelle. Just as a reminder, I've spoken with many members of the House and the Senate and members of the legislature with respect to those Easter storms. We are requesting that the federal government and FEMA add 7 counties to that emergency disaster declaration. As I have said repeatedly to everyone across the state, those guidelines that we must meet before we request that, and the damage assessments are critically important to getting that accomplished. Thank you to everyone, both individuals in those 7 counties and our elected officials and our emergency management coordinators in those 7 counties for helping get those assessments done so that we ensure that you meet the threshold. And for those counties that are remaining, we want to continue to work with you to try to get you added as well for both IA and PA assistance. And so with that, I will open the floor to questions. Courtney Ann.
I know that we've seen both the Air Force and West Point talk about planning, and Air Force has already had theirs an outdoor graduation ceremony. It's my understanding that some school districts in Mississippi are still trying to figure out what they need to do. They want to know if they could hold outdoor graduations on a football field, for example, with folks wearing masks, socially distanced.
Well, what I would tell you is, first of all, while I recognize that school is typically out and that graduations typically occur in early to mid-May, at this point I would say it's premature to be looking at that time frame, particularly at that time frame with large numbers of individuals in the crowd. And so as you think about it, what I would suggest is first of all, to be patient. And I know that's extremely difficult to do right now. We are coming up on April the 30th, and as you know, the White House currently has guidelines for groups of more than 10, that they are recommending that groups of more than 10 not get together. And what I would suggest to you is that may change coming up on April 30th. I can't tell you that with certainty, but let's wait and see what they say at that point. But I don't envision, even if you were to put individuals 6 feet apart, which I think would be acceptable, that you would be allowed to have large numbers of family members and things such as that, because it's virtually impossible for that to be the case.
Dr. Dobbs, you talked about lowering the threshold for testing. What does that say about where we are as COVID-19 is concerned in our curve or flattening the curve? And secondly, talk a little bit more about the qualifications to get the testing now at that lower threshold.
Sure. So there's a lot of indicators we look at as far as kind of where we are in this pandemic for Mississippi. And we have seen some declining demand, at least from the state lab perspective. There's been less need. So we've also expanded our capacity. We can do more tests. So it's always been a layered approach, right? Every time we can move one layer bigger, we want to. We want to be more inclusive, and so that's part of it. I hate to say that it could be an encouraging sign, because it might be, but we just really don't want to be premature and anything of that nature. Now, as far as getting tested, from 4/5 of the tests are done in private clinics. Certainly, we have not had any testing criteria for them. The individual physicians and nurse practitioners can make their own decision, and so a lot of those have been done under this sort of, broader sort of perspective. And the community health centers too, which I think have done a fantastic job. I've got to talk about what a great job they've done. But because we have more capacity, we want to open it up a little bit and look at targets, not just random targets, but high profile areas where we have transmission. People who have symptoms, even if they're not severe, because we know it can be mild. And if someone really thinks they could have been exposed, maybe they know someone and might need to get tested, as long as we have capacity, we would like to be able to offer testing for those individuals too.
Jack from Clarion Ledger has a question.
Great.
Jack?
Hey, Governor. There have been some large outbreaks of coronavirus at meatpacking plants in states across the country. Are you aware of any outbreaks at Mississippi meat processing plants? And if so, where?
Yeah, there have been some very, very large outbreaks around the country. We actually spoke with Dr. Burks about that on Friday afternoon or Friday morning, whenever we had our call. I am not specifically aware of any outbreaks in specific plants, although just looking at the numbers, I have seen some upticks in some communities where there could have been some small outbreaks. And so I don't know if Dr. Dobbs is aware of any specific outbreaks or not in meatpacking plants.
We've had certainly cases like we've mentioned in certain communities that we're investigating. A lot of transmission is occurring in certain areas. I'll say, if we look at the counties where we're seeing significant transmission, and it's stuff that you guys can see too. Scott County has seen a significant number of cases. Leake County has seen a significant number of cases, and so we're going to devote a lot more resources into those areas, trying to see what we can do to help. Been working with healthcare systems in those areas, and so that will be ongoing. We do not have knowledge of an outbreak with transmission occurring in a meat processing facility, but certainly, we've had people in every industry who've had COVID.
Yeah, and I'll just follow that up by saying on the White House call that we just had, we did have a conversation about this topic, and one of the themes that appears to be becoming more and more clear is, even in those cases in which they have had outbreaks in and around meatpacking facilities, in many instances it is believed that the outbreaks are really more surrounding the communal housing that is being utilized either by these facilities or in our state in some other types of housing units or transportation units. For instance, you've got certain communities that get in small vans, for instance, and travel back and forth to work. That is certainly lends itself to more transmission even than perhaps on a factory floor. So again, Dr. Dobbs is looking at any specifics in some of those areas, and we certainly want to be very supportive of that effort as well.
Quick follow to that. Is there a threshold or anything that would have to happen that the health department could come in and force a closure of a facility like that versus the company itself?
Boy, I'll tell you, I'm sure it could happen. I can't envision that happening. We've spent a lot of time talking to industry, and especially some folks in the agricultural industry. They have been very receptive to recommendations for making things safe and have actually been extremely innovative in some of the things that they've done, especially around making sure that their employees are wearing PPE or have other environmental things built in that would minimize transmission. So I would like, I don't have knowledge of every single industry, but the ones that we've had opportunity to work with and to assess what their processes are have been really innovative and have really been a great testament to the work of Mississippi to protect our workers.
I would just like to also add, and many Mississippians follow the national news as well, and there is becoming more and more concern nationally with some of these processing facilities being shut down, that we could find ourselves in America and across the country with inadequate food supply, particularly meat products. And so we as a country, and then this is not specific to U.S., but I do want to say we as a country have to be very cognizant of the fact that we cannot find ourselves in a situation in which livestock or other things that we depend on as part of the nation's food supply are rotting while we're running out of food across the country. I mean, we're not there yet, but there are beginning to be people having those conversations and putting up warnings that we've got to be very, very careful in putting ourselves at risk. You know, the president once said that we've got to make sure that with the coronavirus that the cure is not worse than the disease, and we're nowhere near that at this point, but we do have to be cognizant of the side effects of the short-term public health side. Renee?
Dave Elliott from WLOX has a question. Dave?
Thanks, Renee. Good afternoon, Governor. Your latest safer at home order has a sunset date of May 11th. You've implied that's kind of a moving target, that you'll be evaluating and reevaluating conditions on the ground. Kind of a two-parter here. Generally, what does that process involve, and how might it apply to the two things we seem to hear most about: restaurants and, of all things, hair salons?
Yeah, well, thank you, Dave. Appreciate those questions. You're correct. The current stay-at-home order does have a 2-week period on it as it currently exists. It went into effect at 8 a.m. this morning. Will run until 8 a.m. 14 days until today. But we are literally having conversations every single day regarding not only where we are in totality as a state. We're looking at individual county data and regional data. And there's no doubt that there are a lot of issues surrounding hair salons and barbershops, et cetera. We're looking at the potential of trying to develop guidelines under which perhaps they could open at some point in the future, maybe sooner than the 2-week period. It's certainly my goal and my wish to be able to do that. And so we're having those conversations every single day. We had a conversation regarding that earlier today. The same can be said about restaurants. Restaurants are currently able to be open, just no dine-in service, and so we want to continue to monitor that. As you know, many cities shut down restaurants before we as a state shut them down. We had allowed them to stay open as long as they could adhere to social distancing guidelines. I am very interested to see what direction the White House goes with respect to their 30 days to slow the spread, which is going to expire on April the 30th, which is Thursday of this week. That will give us further guidance in terms of what they're seeing nationally, and that will be very, very helpful. We now, as a state, have over 6,000 cases in Mississippi. As you've heard me say, I guess every single day I've been here, the number of cases you have in a state is largely contingent upon how much testing you're willing to do and how much testing you've done. Mississippi has been a leader in the number of tests, and therefore we've been successful to the extent that's a relevant word in capturing a lot of coronavirus in our state. And we've also been able to do a lot of testing, identify a lot of people, isolate a lot of people, and therefore protect the integrity of our healthcare system. But to simply answer your question, we are monitoring both of those areas, hair salons, barbershops, as well as restaurants, and are trying to find safe ways to get them open as soon as is possible.
Megan West from WAPT has a question.
Okay.
Megan?
Yes, hey Governor, this is an unemployment question. We talked to a woman who was trying to file for unemployment. She made 700 phone calls, and she still hasn't been effort. What would you say to her and others like her who still haven't been able to get the benefits now?
Okay, Megan, I had a hard time hearing you, but I think what you asked is that you spoke with a lady who has not been successful at getting in through the employment security website or otherwise, trying to call the line. And what I would say to that lady who has not been able to get through yet is I am sorry. I know that these are difficult times. I want you to know that once you get through and once you get settled and once you get confirmed as being eligible, that your benefits will be paid to you, and they will be paid to you based upon the date that you were let go, not based upon the date that someone answers your call. We have seen significant progress as it relates to this. We had 2 weeks ago 46,000 Mississippians got through and filed for unemployment insurance. This past week, that number fell from 46,000 to 35,000, which, by the way, would have been 35 times more than were done just 5 weeks ago, but it is a little bit less than was done the week before. We have increased the number of people answering the phone at Employment Security. We had about 50 people on those rolls 5 weeks ago. That number is now up to 250 people. We are having to add those who are doing database management as well as programming within the department because we are having to reprogram our computer system because we have new pandemic unemployment assistance that is available for certain segments of the population that were never eligible for unemployment assistance before this pandemic occurred. And so we got that done, and we announced that last Tuesday. As I told you last week we provided $72 million in benefits to Mississippians. Of that, almost 75% of it was money that came directly from the federal government because it was related to this particular pandemic. And so we've got more work to do. We're continuing to work hard. You can go to your Mississippi WIN job centers now. You can reach out to the WIN job centers. You can send them an email. You can go on their websites. And so we are trying to open more and more avenues for more and more people to get help.
Jack from Clarion Ledger has another question. Jack?
Hey, just following up on what we were talking about earlier, you guys had mentioned, that in Scott County there have been a lot of cases. Not quite sure yet if it's connected to the processing plants there, but is there any concern about the Latino residents in that area? As we all know, there were federal immigration raids there last year, and some of those folks, they don't speak English, or sometimes they don't even speak Spanish, just like a regional dialect from Guatemala. Has there been any difficulty communicating with those folks and getting them to trust the state government and get tested?
I can tell you what we've learned so far and then give you some statistics. So if we look at what's happening in Scott and Leake County, it's still about half the folks are African American, even in those counties. So it's important for us to remember who's been most impacted, and so we still need to make sure we have a focus on that everywhere. If we look at the remainder of the population, it's about 25% Caucasian and 25% Hispanic. So there are significant populations of folks from Latin America there, and so that's not super surprising, although it's clearly disproportionate, most likely. From our conversations with healthcare providers in the area, They are seeing a significant number of Hispanic folks who are getting tested, which is encouraging, and applaud the work of the healthcare system there. Certainly, we are working to make sure that we approach this in a thoughtful and delicate way, bringing on additional translators and folks who are proficient in Spanish language communication so that we can meet the needs in a way that's non-threatening, because this is just a service, a way of helping people, and would in no way be linked to some of the fears that we know could be out there.
Director Michelle, a new study, hurricanes, they came out, and we've all know there's going to be a heightened risk. On average, 10. They're predicting about 20 named hurricanes. Are you shifting any more resources? I know you're probably stretched thin with coronavirus. Are you shifting any more resources to better prepare? I know we're prepared, but better prepare for those hurricanes that may come our way?
Sure, good question, and we've had a lot of inquiries like that. Yes, we are looking at going into this hurricane season a little differently than we have in the past because of the resources, how they've been utilized and where they're spread. We've got good capacity because, and this is one of those situations where the National Guard is a very huge asset to the state of Mississippi, and we actually talked with them this morning with Colonel Smith, who's the National Guard's liaison there with us, and so we're looking at contingencies there. But the good thing about the coastal counties is they have a lot of good capacity that they built up over the years, and the 6 coastal counties, which are primarily the ones that are affected there, to also include Forest and Moore County as you move further up. They all have really good capacity there. So we looked at that, and we're also looking at other counties that are further up north that would be out of the belt that would be able to provide assets as well. So we have been looking at that, and we'll continue to do so as we go into the season.
Dave Elliott from WLOX has another question. Dave?
Thanks, Governor. Today, Lieutenant Governor Hoseman, Speaker of the House Gunn, announced they'd reached an agreement to reconvene the legislature on May 18th. Among other things, the $1.25 billion CARES Act money coming to Mississippi in the 2021 budget, which begins July 1st. Considering the lost revenue of the last 6 or 8 weeks, how will that impact the budget moving forward?
Well, thank you, Dave. I would anticipate that the lost revenue is going to be a real challenge for state government. It's going to be a real challenge for local governments. It's going to be a real challenge across the country, and it's certainly going to be a challenge in Mississippi. I will remind you that the CARES Act, which provides money to governors across the country, cannot be used to make up for revenue losses. That is spelled out very clearly in the legislation. It's also very clear in the guidelines that are proposed by the United States Treasury Department. And so we're going to have to find other ways, working with our friends in the legislature, in the House and the Senate, to deal with the budget challenges that we face. And we'll just have to wait and see as revenues come in, particularly in May. The April numbers that we have seen thus far, actually the sales tax receipts that I've seen are down somewhere between 10 and 15% in April relative to expectations. Not nearly as significant as one would have anticipated. Individual income tax receipts are down significantly. At least they were through the end of Friday. But that's not surprising because, as you know, we worked with Commissioner Frierson at the Department of Revenue to delay when state tax receipts were due for individual and corporate income taxes. We removed that from April. We moved it from April 15th to May 15th. And so I would submit to you that we're not going to have a really good feeling as to exactly where revenues are going to be for the current fiscal year, which is the number one priority, until we get May numbers in. Once we get May numbers in, we will have some idea in June what this current year looks like. And there's really no way to build, in my humble opinion, and I've only been involved in the process now for, this will be my 17th year, but in my humble opinion, there's no way to really know what next year's budget may look like until we have a better feeling of what the current year's budget's going to look like, and we're not going to have a very good idea of that until early June. everything else that is being discussed. And there are lots of good, smart people looking at it, but it's really speculation until we really get some good information through the end of May of this year.
Jack from Clearing Ledger has another question. Jack?
Yeah, North Carolina recently announced that it would begin releasing the names of nursing homes with Outbreaks, joining several other states saying that it will release that information. Have you guys considered releasing this information for the sake of transparency?
Well, let me just say this, Jack. It's a great question. I'm gonna let Dr. Dobbs issue the specific question, but I do want to reiterate that throughout this process, we have worked with the health department. They have, as they have felt more and more comfortable, as more and more information came in, they were willing to release more and more information. A prime example is that in Mississippi, we were one of the first 10 states in America to actually release information with respect to race and how this particular virus is impacting the various communities differently and disproportionately. And so they have certainly been very willing to do that. And I don't know specifically about this particular question, but I'll let Dr. Dobbs mention that.
Thank you. And we understand people's interest in this question. We still have considerable concerns and talk about it regularly. Stigmatization of people who are in the long-term care settings, and there's a considerable number of them, right? So that have been affected. Even and some of them have fallen off active. So, and the other thing that is very concerning is stigmatization of the center itself. Especially in the setting of employee shortages. So we still think there's considerable harm that could be done by releasing the name of the long-term care settings, but we'll continue to reevaluate that as the days and weeks go on.
Thank you. Any other questions? Seeing none, I want to thank everyone for giving us the opportunity to come before you today. We will be back tomorrow at the same time, so if anyone has any questions, please reach out to my team between now and then, or we'll see you back here tomorrow at 2:30. Continuing to work together, we're going to make a difference for Mississippi. We're going to slow the spread of this virus, and we're going to get back to normal as soon as is humanly possible. Thank you all, and God bless.